So, as a person who has been usually traveling to many places, and also always engaging with the different levels of people, now that with this COVID-19, you must have to stay at home without any
Mm.
travel, without not face to face engaging with people. How do you feel about this COVID-19 virus and this particular context?
I mean, I don't know whether this has been a new experience, a shocking experience that never in life that the entire country has been locked down for the more than 3 weeks already. We have never experienced this. Something it has really shaken the what would I say the all the people in terms of where to go, how to just move forward. That kind of situation I am now in, almost at home. Uh, it's something that I just keep engaging myself in getting to know about this COVID-19, how it impacts and affects all over the country. When I just see that it has impacted and it has affected a very bad way in European countries, especially States and France and Spain and Italy. It's something unimaginable. How come that they got this effect, this much of what to say, bad impact or effect when they are living in a more sanitized and sterile environment than most of us who are living here? That's one point I would like to say. The second point, what I would like to say, our government, it has taken this COVID action a little bit of a late. It has just given more than 6 weeks. They didn't do much of the things. Suddenly, even though the first death in India took place in January third week, it didn't take very serious efforts. Only in the third week of March, the government came with much more fast way of just doing things. The fast way also has made it in such a way that they locked down one day on March 22nd, and immediately after 2 days, government locked down 3 weeks continuously. Of course, we got to also accept that this is virus spreads through human to human contact. So social distancing is much more important in order to contain the virus. But because it's a lockdown has just taken place soon, immediately, without even giving a caution to the people, or making them people to prepare themselves how they can live in this lockdown, it has brought a lot of pains, a lot of struggles, a lot of difficulties, a lot of inconveniences, especially to the people who are migrants, mostly working in the cities, actually. Soon after this lockdown, 20 to 21 days, so 3 weeks lockdown, they lost their job. They do not have any homes to stay, and they are uncertain about how they will be able to support themselves in the cities where they have just come for work. So almost what they did it, even though the policy of social distancing is to contain this COVID virus, they couldn't able to. It couldn't be followed by them. So most of the people rushed to the railway station, the transport where no transport facilities available. So most of them have started walking to their homes. Some people have walked more than 800 kilometers. Some
800
people have 1,000
kilometers.
kilometers.
Eight.
Yes,
Huh.
800, along with the children sometimes.
Oh.
So I would say that more than COVID death,
Yeah.
I am a little bit afraid there will be starvation deaths later, because 1 week they can manage. Now
Yeah.
it's already 1 week has passed. Next 2 weeks, what will they do? We do not know. Government has announced some economic packages, but the delivery mechanism is rather very bad, very poor. So it's rather a tough time for them, especially migrant workers, construction workers, daily wage earners, and unorganized sectors. And a lot of the people who are employed in MSME, micro, small, medium enterprises, all of them lost a job. So that is something, as a social person who have been engaged in social work for many years, this actually is paining a lot. Of course, the middle class, upper middle class, they can manage themselves. But in terms of those people who are really unorganized sector and migrants, it's rather, I think we should have done much more planning, much more way how they can be protected. Life and livelihoods, there is no trade-off. We need to look both, actually, especially for these marginalized people.
So, as a person who have been compassionate with poor and the marginalized, uh, how long would it take this situation will last? You know, the virus, of course, the disease we don't know, but if it takes for 5 6 months or 1 year, what will be the status in India?
It will be a very grim situation. A lot of information now I am getting. This lockdown would be extended, and maybe also till May or June, giving in between intermittent and in a little bit of a gap, 5 days, something like that. So this lockdown will be continuous till May, June. So that is what I get the information, and many of them also just thinking on this line.
Yeah.
If that is the case, then the economy will go down. There will be no work, and even for the middle class, lower middle class, many of the people will lose job. And you can imagine that the migrant laborers, daily wage earners, and the people who are working in unorganized sectors, and most of them will be unemployed, and the money in their hands will not be enough to sustain themselves. Of course, the government economic packages will not also be enough. So it's rather a tough situation for them, and for including the lower middle class and middle class. But what hope I have is that all through all through the life of the poor people, they have been very strong in terms of their resilience, coping up mechanism. So I think something that resilience will help them to overcome this. And I do expect maybe after 2-3 months, slowly coming back to life. But by the time, I couldn't able to imagine how many people will lose their life, how many people will lose their job, how many people will really die in this infection. For example, this infection also, because we have not done test in a bigger way, this low infection rate is shown. And especially in the last 4-5 days, there is more than 100% increase of infection. So you can imagine in next 2-3 months, the number of infection will be able to just imagine. It will be more than, for example, in Tamil Nadu, 90,000 people are home quarantined. In one of the 29 states, you can imagine 29 states. So even if home quarantine is 50,000 families in 29 states, it comes more than 1 million.
Yeah.
So the infection will be, I mean, already government is also preparing themselves in terms of providing medical infrastructure, health infrastructure, in terms of number of beds, in terms of doctors, in terms of things like that. But again, there is also less of protective gears, even for the doctors and the nurses who are in the front line. So it's rather a toughest challenge that government has to face, and we all as a people have to face. And one good thing also, I just see the partners with whom I worked, they started also responding in their own small way within their own localities. So a grim sense and the bigger challenges and little bit of resilient hope and a bit of people to people concern. That is also I experience. A mix of everything.
Yeah, yeah. So, talking about the medical facilities, just now you mentioned about medical facilities. Is it enough? Is it satisfactory? Of course, the frontline people are working very hard, but about the infrastructure that you mentioned, even in Western countries, developed countries, they say that the facilities that are available, the infrastructure that are available is not enough comparing to the number of cases and deaths. So, what is the situation in India, and what will be the situation?
I mean, the number of beds